Hello and welcome. Today we're going to be talking about health, healthcare, and disability. When it comes to health, healthcare, and disability, you have to recognize that over time things has changed. What has changed? Society has changed. Globally, societies have changed. We've, in a sense, left the agrarian way of life behind. Not to say that people don't still farm. It's just that only 2 out of 100 people in the United States, for example, farm, and the rest of us, because we live in a capitalist economy, have to go out and get jobs. Now, the advancement of society, the evolution of society, the growth of technology has put us into this modern spectrum of health and illness that differs from traditional attitudes toward health and illness and traditional cultural viewpoints regarding health and illness because of the advancement of medicine, the bureaucratization, and basically creating a formal organization out of medicine into the healthcare field, and then our ability to solve social problems and being able to help people has grown essentially. So, again, from a historical perspective, we have to see where we are in modern times compared to where we have been historically in the past, for example. And as we're seeing, the lifespan over time has grown longer and longer and longer. Okay, so to study these constructs, we can take a systematic approach. We're going to take a bureaucratic approach to how medicine has evolved into a system of interrelated parts in which all of those parts contribute to the whole, for example. We can also take a holistic approach focusing on the whole person, biopsychosocial, and then focusing on society and healthcare from a social perspective, thinking about how do we treat society, groups of people from a holistic perspective, biopsychosocial. And again, since spirituality is relevant to people, we also have to treat that side also despite the rise of secularism, things along those lines. We still have to respect that. And when you look at it, health and healthcare from a medical perspective, treating spirituality is also a big part of it, which might sound a little bit odd, but when it comes to things that are of health and healthcare, that is something people turn to. So despite our own personal bias, we have to be very considerate of other people and where they're coming from their perspective of health and healthcare, and that is often influenced by things like religiosity. Okay, so that's just some fun side stuff, but whenever you're like working with nursing students, for example, you really have to focus on some of those things because that matters to other people. And so if we're going to treat patients holistically, that's how we have to approach it, for example. So again, healthcare, very interesting. We can look at it from a micro perspective of how all these individuals are working, doing their jobs to contribute to the whole. We can look at it from a macro perspective, looking at how the system itself is structured by the individuals working together as a whole and institutionalizing the system, standardizing the system as a whole. So, again, very broad field. This is just an introduction to the study of health, healthcare, and disability. So again, healthcare in the US has been affected by the rise of technology, not just with medicine, but also procedures and equipment. It's been influenced by the bureaucratization of the system. So there's checks and balances, for example, there's budgets, there's labor, there's cost, there's goals, there's outcomes. There's the formal and the organized aspects of it. Again, the training, the education, the certification processes, all the policies and procedures, the insurance, the accounting, the taxes. In the US, though, there's different types of healthcare systems, and in here in the US, it's not a completely social system, albeit people that need help can get the help. But in the United States, it's a pay for service system in which each individual is responsible for the cost of our own healthcare. So again, we don't pay taxes to really cover that, so we have to cover our own healthcare. Okay, so the Affordable Care Act was designed to help other people get access to this bureaucratized, formal, for-profit system that is highly organized and requires funds to be able to get access, to be able to get the health care, for example. In America, we have private insurance, and other companies, they have, or in America, we also have public insurance when it comes to the government insurance. And then we also are looking at preventative care from a government standing. So we do have some, public programs that do help with insurance, like the Affordable Care Act, and some preventative care to help with disease and vaccinations and things along those lines. But in general, in the US, it's a very private system. We're each and own responsible for our insurance. We're responsible for our medical care that's not paid for by the state. So, from a global health perspective, you have the world systems theory, and this is the idea that the way the world looked during colonial times, with European countries on the top, Mediterranean and Asian in the middle, and Latin America and Africa on the bottom, when it comes to the social class ladder and who has higher life chances and overall socioeconomic status. The same argument goes for healthcare in that those countries that have the very well established capitalist systems with high, average incomes over $50,000 a year for its citizens have more access to healthcare than countries such as China, where the citizens only make $7,000 a year. So, who is getting the better healthcare? That's a big question. So that's world systems theory. Life expectancy and infant mortality rate measures tend to be higher on in those countries in which the socioeconomic status is high. So therefore, the countries where people have high socioeconomic status tend to live longer, and the death of babies tends to be reduced. So again, socioeconomic status and life chances is directly associated with your access to healthcare. And so in the United States, you can ask questions like which groups historically do not have healthcare? And you can say those are the ones that don't have high socioeconomic status, they have less life chances, like minorities and people in poverty. Okay. So again, how much is poverty associated with whether or not you have access to healthcare and whether or not you live in a place where your healthcare system is advanced, where you can get procedures that are very complex. Okay. So again, in the United States, even though we don't have the highest ranking when it comes to healthcare, we still have the technology to support it, but generally just for those that have the finances to be able to get that. And so, again, you're going to see a lot of inequality when it comes to the healthcare system. So, social epidemiology is the study of diseases, okay? Studying chronic, which is long term diseases, and acute, fast term diseases. When you're going to study diseases, you have to account for differences in sex. And a lot of times, when people are like testing out drugs and things like this, they don't evenly test it on men and women. And things have different effects on men and women, for example. You do see slight disparities when it comes to racial and ethnic differences. But again, not all people of one race share common genetics, but some people that are African American or identify as African American identify as Asian or Chinese, identify as white or American. They share heart disease genes. So again, the way race actually works is those people that share those genetics, whether they be Asian, African, or a white person, even though I don't really do race, and we've talked about this. Um, they're the ones who are actually a race. So again, this idea that all black people share common risk for heart disease, that's inaccurate. A group of people on the planet share risk for heart disease in their genes, but they're not all black. Again, there's some white, some Asian, and some African, and those people are all actually probably one race of people. You do see again the social class differences and access to healthcare. Again, life chances, your ability to rise up the social class ladder is the key to most things. So, again, groups that have been blocked out from being able to rise up the social class ladder because of their race, ethnicity, sex, disability status, religion do not have as much access to get good educations and good jobs and get that wealth to have some more power over their lives to be able to work their way up the social class system. Okay, so there are environmental concerns that are not just like toxic environment and the destruction of the environment, but also the social context. Is there drugs? Is there violence? Is there abuse? Is there nutrition? Do they have food today? And so, what you're going to find when you study psychology is there's a direct association between intelligence, development, and whether or not you had food today. So, again, the most important thing regarding a child's intelligence is food. And so, Right now, you have starving children in Syria, for example, and they have the listless look, which means that their brain is slowly shutting down due to lack of food. It's not as active, and that's going to permanently affect their development, which is why this idea of, how do we help all children get at least some food and get a good education, because that would balance the equation. All a kid really needs is food, an education, and some love, like a hug. And it doesn't matter if they're in poverty, as long as somebody loves them and like believes in them and gets them some food and a chance to go to a good school. That's really the overall balancing equation. But again, how much is access to healthcare and having nutrition? How much does that affect at least one-fifth of all children in the United States? So again, how is the of health of one-fifth of children living in poverty permanently affected, throughout their life? And then how does that affect their long-term longevity, how long they live, mortality rates, all kinds of things. And so, again, guys, everything is this blend, this biopsychosocial blend, because whether or not you live in poverty and whether or not you ate isn't associated with your physical development. All right. So lifestyle factors are a big thing, drugs, alcohol, smoking, obesity, how are you living? And then what you tend to find is those risk factors are higher in poverty also. You're more likely to smoke if you're in poverty. You're more likely to be obese if you're in poverty. You're more likely to experience violence and abuse and starvation and higher risk of sexually transmitted diseases. And so, again, it's, how much of sexually transmitted diseases is associated with poverty? Well, there's an association there. So, again, that's sociology, is being able to think about all these variables like race, sex, gender, ethnicity, neighborhood, where you grew up, region. How is that associated with your health? Because it all is associated with your health along with your genetics and along with your cognitions. Because if you're the type of person to be nervous and stressful and full of anxiety, well, that ends up affecting your immune system, which then is associated with higher risks of heart disease. So, yeah, your thoughts can influence whether, you have high risk of heart disease. Your environment is associated with it. Your genetics are associated. It's a very complex process, but that's why I love social sciences. It's a biopsychosocial process that we have to understand. So again, in America, we have this pay for service system, and other places you have universal health care where it's guaranteed. Then you have socialized medicine where people pay into the tax system. Then we have holistic medicine, which is taking care of the whole person. And then you have these ideas of cultural influences, as I've discussed. Where are people coming from? How much is religion associated with their, thoughts about health and illness and things along those lines? So, from a functionalist perspective, okay, what is the meaning of health and healthcare? Health, again, is arbitrary and a culturally constructed and culturally influenced concept. Some people believe health is just maintaining that balance between yin and yang, positive and negative. Some people just define it as simply feeling normal. And then healthcare systems, again, vary. So again, from a functionalist perspective, what's the purpose of the healthcare system? You can say, okay, what does the healthcare system do for society? Well, it takes care of its people's health, which makes sure they can become better workers, which then helps the economy. And then if you can take care of people's health so they can get good jobs, they can then take care of their families. And then how much of health is influenced by the media? Like, you hear about a drug for heart disease on the news or as a commercial, then you go to your doctor and you ask about that drug. So again, healthcare is a major institution of society. So when you look at the institutions of society, you have the family, the economy, government, politics, military, healthcare, the media, and all of these structure our way of life, structure our access, and also structure our ability to, live a good life, for example. And so, America, we have these very highly institutionalized economy, institutionalized family systems. We have all of these institutionalized institutions that structure our life, and the health and healthcare system is one of them. Okay, so from a conflict theory, again, you'd be talking about things like inequality and how does having socioeconomic status belonging to the upper classes associated with you having access to health and healthcare. And a symbolic interactionist would say, guys, we're the ones who are constructing this system. Not only are we the ones defining the meaning of health and illness through, interaction with other people, but it's also interacting with other people that we build this system. Because again, the system is nothing more than a bunch of people fulfilling social roles And then, how are they learning to fulfill these social roles? Well, they're doing that through social interaction. Then they're all working together to build these hospitals, is to build to study medicine and to do research and to implement a healthcare system and to try to have good outcomes by saving patients and helping people with cancer and AIDS. Okay? So again, mental illness versus physical. There's a great debate, because when you got to ask a lot of questions, what is a dysfunction and what is not? And so, from psychology, you have to realize that all disorders, all diagnoses are influenced by cultural attitudes based upon what is normal and what is not. So again, it is society itself that dictates what is normal, which then influences whether or not we diagnose something as abnormal. Okay, but what are the causes of mental illness and physical illness? Okay, what are the symptoms and what are the treatments is the best way to approach any of the problems relating to health and healthcare? Whenever I'm going to write a paper for psychology, I always think about causes, symptoms, treatments. It helps me structure, and focus on what I need to focus on to really understand the disease or the disorder I'm studying. So again, when it comes to mental illnesses, these all these illnesses are cultural constructs, but we're the ones who socially define what it is. But we do have a book, the DSM-5, that does guides us in our diagnoses to at least have a checklist, and then this is standardized and certified by many hands, and so it's a very formalized, bureaucratized system, the mental health system, as is the healthcare system in general. Okay, so I love psychology. I'm all a big psychology buff. My PhD's in psychology. I just am obsessed with sociology at the same time. I don't think you can have one without the other. So again, whenever we're talking about anything, we're always talking about, the blend of psychology and sociology, and then incorporating genetics and biology to account for other phenomena, because you can't understand anything if you understand biology. I mean, that's just the way it is. How are you going to understand people without understanding how the body works and the brain works, like the actual structure of it, and how that's motivating you to go interact with other people and to be social, you know? So when it comes to disability, it's the same exact thing. Like I ask amazing questions all the time. Like, is autism a disability? Or is autism actually a human evolution, an adaptation? Because if you see what an autistic can do, the ability of their memory to conceptualize and take in everything that they're seeing and then being able to reproduce that with pen and paper, to be able to play an instrument and do math in colors. Autistics can blend colors in their brain and do math problems. I mean, there's some incredible things going on. But again, when it comes to autism, they call it an attention disorder because evolutionarily being able to think about more than one thing at one time, that's what happens when you're autistic. You're getting a lot of stuff at once, whereas everybody, the person that is defined or labeled culturally as normal, their conscious mind can only think about one thing at a time. We're all very limited. But what would happen if our consciousness was, interrupted or, our attention was somehow changed? And so again, this gets you thinking about whether autism is a disorder, whether autism is just an evolutionary adaptation. And same thing with intersex. And I have this debate a lot too, because there's a minimum of three sexes, male, female, and intersex. But intersex comes in so many combinations. And I always say, well, what's the evolutionary adaptation of being intersex? And it's like this. Well, what if one disease wiped out all the people with just XX chromosomes? Then the people that had a blend of XXY could reproduce. So even if we lost all the women on the planet, humanity could go on. So again, is intersex an adaptation? And that's a beautiful way to look at transsexuality. And it opens your mind to some intriguing concepts. But again, so disability status, simply the easiest way to say it in the most politically correct way, because again, I'm pretty anti labeling anything, but as something that impairs you or limits your your ability. Okay? Somehow you're impaired. And again, but we're all impaired in some way. So again, I hate to create separate categories for things when we're all the same and we all experience things the same. But again, it's just that's why it's a great debate. It's a good back and forth discussion of what's appropriate, what's not. Is it a disability? Is it not a disability? And so it just creates interesting questions. Okay, so there are intellectual and physical impairments that culturally can be diagnosed as a disorder. Okay, all right. And again, this is a tough subject for me because just I don't labeling has powerful effects and categorizing of people has powerful effects. And you can see my stances on this when I talk about things like race and are you actually white or black? And again, I'm trying to show you that, there's no such thing. We don't actually like the races that we have are really just ethnicities. They're not even races. There's blendings and groupings of people that share some kind of culture. But I mean, all Americans share a common culture. All right, so again, the stereotypes attached to the labels. Okay, and then that's again where you get into trouble because once you label something different and then you create a stereotype, a mental construct of something, and then you apply negative and positive meanings to that construct, then that's what opens up the door to prejudice and discrimination. So again, we need to be very careful about what we label as different, what we label as a disorder, because the origin of inequality is not difference itself. It's how we apply stereotypes and then create positive or negative connotations attached to those stereotypes. Thank you so much.